Welcome, and we're not talking about just cigarettes. We're talking about all sorts of different tobacco products and other marijuana cigarettes, herbal cigarettes that may not contain tobacco. Anything that lights on fire produces a lot of chemicals that can be inhaled. And then the nicotine effects and some of the direct physical effects of tobacco can even happen from smokeless products like snuff and snoo and whatever else those things that people stick in their cheek are. Go ahead and advance, thank you. So basically, smoking can affect all parts of the body, not just the lungs. And so we're going to kind of go from outside in here a little bit. Really, when you are smoking, that cloud of smoke is surrounding your body. The tar can stain your fingers and your nails. You can have effects on the skin, both from the chemical reaction from the external, but also from the inhaled smoke and the effects from the internal. It causes more wrinkles, premature aging, your breath can smell, your hair and your clothes can smell. So some people are pretty concerned about those physical effects, the physical appearance effects. But then let's talk about what happens on the inside of your body. Go ahead. So in your nose and mouth, you can actually damage the nerves in your nose by inhaling smoke, and your sense of smell can be diminished. You can stain your teeth with the tar, just like you can your skin and your nails, and it also coats your mouth and throat. We already mentioned the cancers that Lori had in the quiz. There are also small hair-like cells in your respiratory tract called cilia, and the effects of the smoke and the chemicals can actually kind of paralyze those little buggers, which are usually responsible for clearing all the stuff you breathe in out of the air and getting it out. That's what boogers are. But because those things don't work as well, mucus tends to accumulate, and that can cause a propensity to more infections and more inflammation. And then, of course, your taste, your sense, and smell. Tooth decay and gum disease, I believe, was already covered by Dr. Womack. Okay. Your eyes. Again, both the smoke that gets in your eyes and from the inside have effects. You can end up with cataracts, macular degeneration, and vision problems. Okay. So the lungs and airways are, I think, what people are most aware of for interior effects of smoking. I mentioned the cilia already. People who have asthma can be horribly affected by smoking, whether it's their own smoking or secondhand smoking. COPD, or chronic obstructive pulmonary disease, otherwise known as emphysema, is a process by which that smoke gets all the way down into the end area of the breathing sac, the alveoli, the smallest area where the actual exchange of gases occurs between the lungs and the bloodstream. And they can actually degrade the walls of those little alveoli and pop them open. It's called a bleb. And so, number one, the fewer of those you have, the less efficient your exchange of oxygen and carbon dioxide is, so you can get short of breath because of that. And it is usually a permanent effect. Once you've scarred those down, they don't grow back. And so COPD or emphysema is generally irreversible. You can also be short of breath just from inflammation in the larger portion of the airways. The mucus is building up. It can be constricted because of the chemicals like nicotine in the smoke, and then even an inhaler sometimes only provides limited relief. Also, of course, lung cancer. People associate lung cancer as one of the number one cancers associated with smoking. So your heart and blood vessels. So nicotine gets from you inhale it basically through your lungs, but then it's one of the chemicals that crosses over into the bloodstream and circulates throughout the body. Directly on the blood vessels, nicotine has effects of causing constriction, thickening, and narrowing. And so that increases the risk for blood clots, heart attacks, and strokes. it can happen in two ways. One is over time, the buildup of the thickening, but also in a situation maybe you're already under stress from something, and so your stress hormone levels are elevated in your system, and then you smoke, that can just clamp it down that much more and be enough to cause actual damage to the muscle of the heart or to the brain, causing a stroke. For men, it also can affect the blood flow to the penis and lead to erectile dysfunction. And on the brain health, even outside of strokes, we're talking about mental health here and the addiction pathways, because nicotine is an addictive chemical. When you inhale it or have it parked in your mucous membranes in your cheek, absorbing it through your bloodstream, it gets up into your brain and it releases a bunch of feel-good chemicals for a while, and then your body starts craving those feel-good chemicals because when the nicotine's not there, they're not necessarily getting released, and that's part of the addiction cycle. So when you stop smoking or take a break from it, even for a few hours, your body craves those chemicals and you start to feel withdrawal symptoms, commonly anxiety, restlessness, depression, irritability, potentially food cravings is a common one. Increased appetite, especially for folks who are trying to quit, is a real issue, and that is part of the nicotine dependence picture. Next. And another effect that people don't even think about, how could it affect my bones? Well, again, blood flow to the bones, nicotine, the chemicals in nicotine affect calcium absorption, and you need calcium to build healthy bones and maintain healthy bones. So that can actually lead to osteoporosis and increase the risk for bone fractures. So your whole body is really affected by nicotine and the chemicals, many chemicals that are contained in combustible cigarettes, cigarillos, cigars, marijuana, herbal, and your DNA gets damaged from all that. We always talk about wildfire smoke, and we worry about particulate matter, PM 2.5, and how tiny that is. And some people are like, well, the filter's helping. Well, the filter gets out some of it, but not all of it. The small ones can pass through the filter, and you are directly dosing this stuff into your lungs. If you're smoking plus a bad quality air data because of pollution or wildfire smoke, it's just compounding the risk. And when you get the chemicals traveling through the bloodstream throughout your body, they can damage the DNA, and so cigarette smoking and tobacco smoking is associated with many, many kinds of cancers that you wouldn't think might be affiliated. It's considered a risk factor for kidney and bladder cancer, because if you think about it, those chemicals get concentrated in those organs before they get expelled from the body. And so that's one of the ones that people are like, oh, okay, I guess it makes sense, but you wouldn't think of it at first glance. Immune system and hormonal changes also. And then next slide, please. And of course, mama to baby, because smoking during pregnancy does a couple of things. One is the blood flow to the fetus is affected, low birth weight, potential other harms, developmental delays, potentially birth defects. We just talked about it affecting DNA. Well, the baby's DNA is developing during pregnancy, so that is definitely something that is very harmful. Next. Yep. So, in summary, smoking affects a lot of different body parts that you might not think of on first glance. And it's really not even just the smoker themselves. Even when you light up, even before you inhale that first puff, there are chemicals being released into the air through the smoke that can irritate the smoker themselves, but also people nearby. So secondhand smoke is a real problem. It's why, for example, smoking has been outlawed in restaurants and bars in California to protect the workers from having to inhale all that smoke all the time. But it can, and then third-hand smoke, I think you guys have covered this in previous meetings, is where it's, stuck in the paint in the walls and the fabric of a curtain or that kind of stuff, and it continues to off-gas. I don't know if you've ever visited a smoker's house, even if they've not been smoking for a while, you can tell that somebody who lives there is a smoker. But really a laundry list of lots of different body parts, pretty much all systems potentially affected by this, and that is why it is such a problem. And then just because, I don't want to leave you on a hopeless note, I do want to let you know that stopping smoking has immediate benefits. Really within the first 20 minutes after your last cigarette, some of those vasoconstriction and vascular changes start to reverse. And then as time goes by, more and more healing can happen. There are some things, like I said, that are irreversible, like maybe some of the lung damage that happens. But really, quitting is the best possible thing that a smoker can do to improve their chances of health. Because on average, smokers die at least 10 years earlier than non-smokers, and nearly 1 in 5 deaths in our country is smoking related.
Yeah, thank you.